Welcome to Season 3 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith Rogers, producer of the Public Health on Call podcast. Today, guest host Colleen Barry, chair of the Department of Health Policy and Management at the Johns Hopkins Bloomberg School of Public Health, talks with Margarita Alegria, chief of the Disparities Research Unit at the Massachusetts General Hospital and professor in the departments of medicine and psychiatry at Harvard Medical School, and Beth McGinty, a faculty member at Johns Hopkins and lead author of a series of studies in JAMA on COVID-19 and psychological distress. They discuss mental health and well-being nearly a year into the COVID-19 pandemic, with a focus on high rates of psychological distress among Latinx communities and policies that can make a difference in the months ahead. Let's listen.
Maggie Alegria and Beth McGinty, thank you both so much for joining me today. Beth, let's start with you. You are the lead author of a series of research studies in JAMA on psychological distress and the COVID pandemic. Can you give a snapshot on what we know about how COVID-19 has affected mental health and well-being in the U.S. from the studies you've led and other research?
Absolutely. The COVID-19 pandemic has had pretty seriously detrimental effects on mental health in the U.S. Our studies show that the prevalence of serious psychological distress has more than tripled during the COVID pandemic relative to pre-COVID. So pre-COVID, typically about 3 to 4% of all U.S. adults met criteria for serious psychological distress in a given year. And we found in the first 2 waves of our survey in April and July that about 14% of adults met criteria for serious psychological distress. And this pattern is very much borne out by research conducted using other metrics such as scales measuring symptoms of depression and anxiety and other mental health measures.
And what do we know from this research about psychological distress among Latinos in particular, Beth?
Psychological distress is particularly elevated among Latinos. So I just mentioned that among overall adults, we found that about 14% are experiencing serious distress. Among Latinos, it's about 19%, so 5 percentage points higher. And among all of the subgroups that we've looked at in our research, Latinos are among the most psychologically distressed.
So, Maggie, those are really high numbers. You've studied mental health and well-being among Latino populations in the U.S. for many years. What do you make of these very high rates of psychological distress among Latinos in the context of COVID-19?
Well, it's not surprising, Colleen and Beth, when you think about that, if in comparison to non-Latino whites, 1.7 more likely, Latinos are 1.7 more likely to test positive for COVID, 4.1 times more likely to be hospitalized, 2.8 times more likely to die. So it's no wonder that they are very distressed. But I also think there are other components. If you think about Latino families, many of them are multi-generational. And so losing elders from their family is going to affect the whole family, including children. I also think the uncertainty of family separation in this country, if you have to go to the hospital, is completely different for Latino families. And then I would also say that if you think about the economic, devastation that this COVID-19 has done to Latino families, early in the pandemic, we know that when they did surveys, they found that 42% of Latino families had said that they had already spent their savings for basic necessities. So you're getting a group that is under very uncertain circumstances in an anti-immigrant climate, very afraid of family separation. So I think all those things are really having a terrible impact.
Maggie, throughout the pandemic, in some sense, we've been having two parallel conversations in the public health field, one about the pandemic and another about racism as a public health crisis. But as we know, these two threads are really wound together. How might we think about the mental health effects of the pandemic on Latinos? And you're already getting to this in your response to the question a moment ago, in the context of well-documented and long-standing health disparities in the United States?
I think you're right on target, Colleen. You know, if you think about many Latinos based on economic indicators live check to check. So when people started losing jobs and being furloughed, we know that many Latinos were in that group. And then if you think about public charge and people not feeling able to access many of the services of the safety net for fear of losing either the opportunity for citizenship or visas, it really delayed people in thinking about what to do in getting support and help. But I also think that we know that there's disproportionate number of Latinos in essential jobs. And these people in essential jobs, many of them do not have sick leave. Many of them do not have employee sponsor insurance to be able to, if they want to get tested or want to do things, get that insurance. They're less likely to work remotely. We know that they are not able to work remotely given the industries in which they are, like construction or the service sectors. We know also that, if you think about losing insurance, many of the Latinos lost insurance in the very early times of the pandemic. Of the 41% of people that were receiving healthcare through their employees, 23% of the ones that were furloughed or lost their jobs were in the Latino realm. So that tells you that this is a group that's going to be hit very, very hard. So I'm very glad that you raised how there are systemic inequities, because on the one hand, this is a group that has very high risk of, like Beth said, having very high rates of psychological distress. But at the same time, one, they don't have where to go. The access is very limited. And I'm going to start with children, for example. We know that children, especially children of color, including Latino children, get most of their care through schools. And once schools were disrupted, this group had nothing. But I also want to raise attention to the emerging adults, where we are seeing skyrocketing rates of mental health problems. I mean, the latest that we have seen is that it has gone from 40% of emerging adults, especially poor emerging adults, 18 to 29, showing signs of depression and anxiety. But by November, we're seeing those rates go all the way to 58%. So this is an area that I think we have to pay attention to how people will access care if they have psychological distress or are actually even more serious.
So I want to pick up on that thread of emerging adults and turn back to you, Beth. In your studies, you saw that young adults were another group that were experiencing seriously escalating rates of psychological distress due to the pandemic. And we know, and Maggie just alluded to this, that there's a large and growing number of young Latino adults in the US. And so this is really a double crunch for this group. Do we know what's driving such high rates of distress among young people? And what might that mean for Latino young adults in particular, Beth?
Yeah, it's a great question. So I would say that we partly know. We have some clues there. So in our work, we did ask about what COVID-19 related factors were contributing to psychological distress. And what we found is that among youth, and these factors drove psychological distress in other age groups too, but were particularly prevalent in youth, as you said. The most common factors that people reported as driving distress were pandemic related concerns around disrupted education, disrupted employment, and disrupted income. So I think it's logical in many ways that these factors would be particularly salient for youth who are, in many cases, just finishing their education or starting out in their work life and their careers. They may not have savings accumulated, so income shocks related to the pandemic are particularly problematic for this group. And, add all of those material circumstances to the fact that these disruptions, I think are really concerning to youth in the sense that they're worried about how is this going to affect me long term? Am I going to be able to finish my education? Am I going to be able to get back on track in terms of my career goals? It's a very uncertain future for many young adults.
Maggie, do you want to jump in here thinking about Latino young adults, disrupted education, disrupted employment, disrupted income?
I completely agree with Beth. That's really where we think it's going. I think many of these youth have seen their parents having to lose their jobs, and also some of the parents with children staying at home have had to stay at home. And therefore, the youth have been taking the toll of having to do the economic source for the family. So this has really created a tremendous gap for this youth to move forward. So I hope that we, focus on them.
There are some great recommendations that we've talked about on our Hopkins podcast focused on individuals and what each of us can do on our own to protect our own mental health through the pandemic. Since you're both policy experts, I want to focus more on the policy dimension. Maggie, and you alluded to this a couple minutes ago when you were talking about insurance and sick leave. What are the policies we should be considering at the federal, state, or local levels to protect the health and mental health of Latinos in the context of the pandemic? What should we be doing now?
Well, I think there's several things we should definitely be doing. I think we know from maps that actually the agencies, National Institute of Mental Health and National Institute of Drug Abuse, have shown that the epidemic, the effects of mental health and behavioral health, substance abuse, it's really very geographically detailed. So we definitely need to move resources to those communities and fast. That's the first thing I say. I would definitely create a task force to ensure that there's full parity for mental health and substance abuse care, especially because we need to make sure that it's not only the legal, but the actual enforcement of parity to make sure that it's there. I also think decriminalizing, light infractions for either behavioral health or substance abuse is actions or behaviors needs to come into play because we're putting a lot of young people in the criminal justice system for very minor offenses. And that, particularly for a youth and emerging adults of color, this will be a problem. I also think we need to incentivize how we reduce the disparities in poor versus non-poor access to behavioral health. We've seen for many, many years now that disparities doesn't go away. And I think we need to put policies that incentivize the lowering of those disparities at the state level.
So just to clarify, when you were talking about parity before, parity is a policy that tries to address the historic difference in the generosity of the way health insurance covers mental health and substance use relative to general medical conditions. So really make sure that we have high quality insurance coverage for mental health in our country through public insurance and through private insurance. Beth, are there other policy levers here that you think are important in addition to the issues that Maggie was talking about a minute ago?
Yeah, two other sort of buckets not directly related to the great options Maggie raised around mental health and substance use service delivery come to mind, given what we know about the sort of drivers of elevated psychological distress and other mental health symptoms. They are socioeconomic, as we talked about, right? Concerns about disrupted education and employment and health insurance. And so social safety net policies are absolutely critical here, thinking about policies that expand sick leave and policies that help people get insurance if it's been disrupted. Medicaid expansion becomes very relevant in this context. If you've lost your employer-sponsored insurance due to COVID, you are better off if you're living in a Medicaid expansion state than if you're not, in terms of your ability to get health insurance. And so thinking about those sort of broader policies that we talk about in terms of sort of COVID relief policies, I think also have real implications for alleviating some of the drivers for distress. And similarly, public health-oriented policies that are geared toward infection prevention and control are also really critical here. Among our overall sample of U.S. adults, the top reported driver of psychological distress was fear about contracting or a family member or other loved one contracting COVID-19. This is a significant driver of distress. So policies around keeping people safe and preventing transmission of COVID are also, I think in this case, mental health policies.
And even more important when we're thinking about Latino populations, given the point that Maggie was making before, that many Latinos are involved in these riskier essential jobs that actually do heighten risk for COVID.
Absolutely.
Maggie, last question to you. A major takeaway from the 2020 election was that, at least from a political perspective, the Latino population in the U.S. is an incredibly heterogeneous group. So we make generalizations about Latinos at our peril. Might this also be the case when we talk about Latino health and mental health in the context of COVID and even beyond COVID?
Absolutely. Absolutely. Because we know that the issue of intersectionality is so important in how people, it's not only being Latino or not Latino, it's actually where you live. It has to do with your acculturation and time in the US. It has to do with the opportunities which you have in that environment, the social interactions and social resources. So I think we would be doing a disservice if we create, assume that this is a monolithic group of people that should be treated all exactly because, your gender identity, your, socioeconomic status. There's so many things that make us different. And so therefore, I think we can do some things in the general sense because there are things not only for Latinos, but actually for communities of color that probably help. Like, for example, expanding the funding for community health centers that really service those populations so much. But overall, we also have to be very careful that we don't generalize and take things, beyond where they are and think about intersectionality as important.
And just define intersectionality for our listeners, Maggie.
Intersectionality is that you think not only from one dimension of the person as being Latino or non-Latino, but you think also on the multiple identities that person has, or multiple factors that define who that person is, that influence their behavior, that influence their values, their norms. And therefore, those things have to be taken into account when you provide service delivery.
Maggie Alegria and Beth McGinty, thank you both so much for joining me today.
Very happy to do it.
Thanks for having us.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, C.N. Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Haggader, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.